cage is, this is the rib cage here, which I am pointing to. This is the rib cage, and the rib cage consists of the bone in front, which is called the breastbone or the sternum. There's a bone, there are ribs here and the side, and at the back you have the vertebrae. So the vertebrae at the back, and that's the vertebrae. The vertebrae at the back, the sternum in the front, and the ribs connecting the two. And the breastbone or the sternum has got three parts, and this is called the manubrium, this is called the body, and this is called the xiphoid process. Over here, there's a little notch here. This is called the jugular notch. So if you, that's where the jugular vein passes. The ribs connect the sternum to the thoracic vertebrae. So the thoracic vertebrae is where the ribs are attached. Okay, this is the thoracic vertebrae. And I told you the classic feature of a thoracic vertebrae is that the spinous process is pointing down. So that's a classic feature or distinguishing feature of the thoracic vertebrae. And when you talk about the ribs, you have to know the three different types of ribs. There is the true ribs, which connect directly through the costal cartilage. So the first 7 are the true ribs. They connect, they have their own costal cartilage. 7, 8, and 9, they have costal cartilage, but they are all connected together. So the 3 of them together have one costal cartilage. So 1 to 7 is true ribs. 8, 9, and 10, they are the false ribs because they don't have separate costal cartilage. They are coming together and connecting to the sternum. And there are 2 ribs here. Can you just come down and take a picture? You can see 2 ribs here. This is 11 and 12, ribs 11 and 12. They are not connected to the sternum at all, but they are connected to the spine, the vertebral column, and they are called the floating ribs. So 11 and 12 are the floating ribs. 8, 9, and 10, 1 to 7 is the true ribs. 8, 9, and 10 is the false ribs, and 11 and 12 is the floating ribs.